Hello friends, I am Dr. Sumit Jaiswal, plastic, cosmetic and reconstructive surgeon. Today we are going to discuss with you male to female gender reassignment surgery. It's done in cases in person who have gender dysphoria. These people are called trans female, means they are psychologically just like female, their thinking, their activities, everything is like female. They have attraction for opposite sex, that is for males just like any other female, but physically they are male, means they have penis, they have testes, and all physical look will be like males. So we can't change the psyche or psychological aspect of the patient, what he think we cannot change, but we can change body, means we should change body according to alignment of its brain, according to its psyche. So in such type of cases, after proper psychological assessment, counseling, we can go ahead with surgical and hormonal aspect, in which we convert them physically from male to female. So first step of this thing is to diagnose the condition that the person has gender dysphoria, that is he is not satisfied with his gender. For that we need consultation twice of psychiatrist. Two psychiatrists confirm that he has gender dysphoria, then only we go ahead with the surgical or hormonal procedure. It's not very difficult thing. If genuinely the person has a problem with gender dysphoria, we can go ahead, and it's very just a 1 day job to get a letter from psychiatrist here in India. After getting clearance from psychiatrist, we confirm that he has gender dysphoria, we can go ahead with surgical aspect. In surgery, the most important surgery, the most commonly done surgery is breast augmentation and vagina creation, penis to vagina creation. Breast augmentation is done by silicone or fat injection, more commonly by silicone. Different sizes of silicone breast implants are available according to patient body and his wish. We can use the desired size of the implant. The more important and complex surgery is penis to vagina creation, in which we do penile inversion skin technique, means we use penis skin and will create vagina, and this penis skin will use to line the cavity of the vagina. The glands of penis will be used to create clitoris. The skin of scrotum will be used to create fold of labia majora and minora. So it's a complex procedure which take around 2.5 hours to 3 hours, and in which we create a proper cavity. Its look will be just like a female vagina, and there will be just only one limitation, that the secretions will not be as same as compared to normal females, although we use urethra, part of the urethra, to line the vaginal cavity to give some lubrication. But still you have to use some lubricating agent during intercourse for such type of vagina. The depth will be according to patient wish and his height and health, and also depend upon what is the length of penis. Normally we give, in Indian patient we give 12 to 15 centimeter of depth. If penis size is more, patient is more heightened, more bigger body habitus, then more depth cavity can be created. There is another option of sigmoid colon vaginoplasty, in which colon intestine is used to create the vaginal cavity lining. But we don't do that surgery because sigmoid colon vaginoplasty is a complex procedure in which we have to go to the, inside the abdomen, we have to cut the colon and then rejoin it. So there is always a potential risk of major complication in it. Also, due to colon, there is continuously secretion from the mucosa, and which leads to wetness of the vagina and bad odor, recurrent infection. And the procedure which we do, penile skin inversion technique, is the most common technique worldwide used by plastic surgeons. Now, cost of the procedure, we are leading center for gender reassignment surgery in India, and we are among top 3 center performing large number of this type of surgeries, both male to female and female to male. But our cost is not too much. For breast implant surgery, our cost is around 85 to 90,000 Indian rupees, which is around 1100 to 1200 US dollars. And for male to female vaginoplasty technique procedure, the cost will be around 2200 to 2300 US dollars. So it include hospital expense, surgeon charge, anesthetist. Only medicines cost extra. Medicine cost is around 100 to 200 US dollar extra. And in this surgery, you have to stay in the hospital for about 5 to 6 days, in which most of the time we do simultaneously breast implant and penis to vagina creation surgery. There are many other different surgeries also which are part of gender reassignment procedure. The first other is facial feminization surgery or FFS, in which we can change facial feature. Many times more masculine features are present, so we have to change according to patient facial features. Most commonly frontal bossing, this brow region is protruded or moving outward in males, so we have to reduce it. We may need to correct eyebrows. Rhinoplasty or nose correction is many time needed for MTF surgery. Some patient rarely request for this malar implant or really chin implant. Many times jawline surgery may be needed. Simple surgeries like filler injection in lips can also be done. Apart from this, other surgery like voice change surgery can also be done, and also laser treatment for facial hair removal, body hair removal may be needed. For body hair, most of the time hormone therapy cause decrease in the volume and amount of hairs. There are many other rare surgeries also, but mostly these are the commonly done surgeries. And hormone therapy is the next topic, with when to start hormone therapy and how to start it. In hormone therapy, we mostly give female hormone estrogen, and many centers start first hormone therapy followed by surgical treatment. The main purpose of or main thinking behind this is that if we start hormone therapy first, it gives patient more time to rethink about the decision of surgery, because surgery is an irreversible thing. So if we start hormone therapy, it gives patient some time so that he can think again he wants surgery or not. Otherwise, we can start hormone therapy after surgery also. Most of our patient, we start hormone therapy about 2 months or 1.5 months after the surgical procedure. Hormone therapy, duration for hormone therapy mostly 6 months to 1 year, but it may need it for 2 years, 3 years according to the patient requirement. After hormone therapy, there will be lot of changes in facial features, body hairs will decrease, more feminine character will appear, the fat distribution in the body will be according to the females. Voice change may or may not be altered after the hormone therapy, so it might require surgical treatment if there is too much masculine voice. So we have a surgical video in which we are doing male to female gender reassignment surgery, and you can understand by this video how procedure is done and what are the potential complication of the procedure, aftercare after the surgery needed. So we will explain about all of these things. There are other videos also which will tell you about breast implant procedure or voice feminization surgery or facial feminization surgery. You can watch on our YouTube channel. You can WhatsApp call us or message us. Thank you so much. Our case is 32-year trans female in which all the external genitalia were exactly like males. The procedure will be done in spinal anesthesia. Lower half of the body will get anesthetized for next 3 to 4 hours. The first step is removal of testes. For that we will make a vertical small incision in between the 2 testes into the scrotum, and we will remove it as high as possible, and we will ligate the base of vas deferens as high as possible near inguinal ring. Proper hemostasis should be achieved, and its 2-layer closure of cord is done. Otherwise there is risk of some hemorrhage or bleeding after the procedure. So now the next step will be degloving of the penis shaft. We will make a circumferential incision. It is distal most part of the penis skin, and will separate it from corpora cavernosa and corpus spongiosum. This penile skin will used to line the vaginal cavity. After separating skin from remaining structure of the penis, we will now separate a glans, and we will use it for creation of clitoris. Glans with its blood supply is used, and we will separate urethra from corpus cavernosa. This cavernosa will ligated as high as possible. You can see different structures. One is skin fold, another is urethra, and third one is clitoris. Now the next step will be the positioning of the clitoris. at the position at which normally it exists in females. Next, we will create cavity. We will create cavity anterior to the rectum and just posterior to the prostate, of just posterior to the urethra. It should be of adequate depth and adequate length so that it can use easily for sexual intercourse. Now we will ligate this corpora cavernosa because it is of no use. We will not convert it into any other structure, so we have to discard it. The extra skin fold will also be removed. This skin of scrotum will be used to create labia majora. Now we will make very small, two small incisions, one for clitoris and other for urethra. Through these holes we will take out the pedicle of the clitoris and urethra. We have more than extra length of urethra, so we have to discard some of the distal part of the urethra. Now we are fixing clitoris. Its blood supply is very tedious, so we have to maintain proper positioning of the pedicle of the clitoris, otherwise the skin of clitoris may get blackened or have necrosis. After this procedure we will remove extra amount of urethra. The suturing of urethra is also important because if it's not done properly, there is chances of urethral stricture or obstruction to urine flow. So we have to spatulate its margin while closing it, so that proper circumference, more than normal circumference, should be there and there should be no contraction. Now we have put some mold in the newly created vagina, and also we are repairing both the fold on right and left both side of the labia majora. This is the final result. These stitches will self-dissolving and they will dissolve after 2 to 3 weeks. This was immediate post-op result. The swelling will subside gradually, and this is result after around 2 to 3 months, and more later this is after 6 months. You can assess depth and width of the cavity of the vagina. We have to use this mold for at least 3 to 4 months so that it not contract in next few months. Proper dilatation is very important after the surgery.